This is a simple bill. Everyone has heard about the bill. I can tell you the intent of the bill in a simple language, and that is that throughout Canada, in each and every year, the 11th of March to be known as Pandemic Observation Day. Now, why do we need to do this? There are about 3 reasons to do this. The first is to remember that 57,000 people to date in Canada have actually died from COVID-19. To remember and honor those people, to also remember that is more than all of the Canadians who died in the Second World War. So this is a huge number of people who died from a pandemic. The other thing to do is to remember their suffering, recall and try to find how we can support them throughout this crisis to all the people who are family of the bereaved. Now, what we need to do with the second part of this is to continue recovering from COVID-19. And I use the word continue because actually since the so-called pandemic was lifted, 7,000 more Canadians have died. Up till today, that's a number. So we know that COVID has not disappeared. COVID actually continues to be a variant. It continues to adapt and change like we know all viruses have a tendency to do. And each time we don't know what the variant would be. So that the important thing for us to do is to remember that we're continuing to recover. Remember that we must continue, therefore, to apply solid and strong public health commitments to what we do. In other words, continue to recognize that while this virus continues, we must wear masks when we're in an unventilated place, that we must continue to wash our hands. We must continue to do all of the things we did during the pandemic because we do not want to have the pandemic recur in large amounts. And so we need to therefore remember the day and learn of the evolution of this pandemic. We have tests, we have vaccines. Get the tests, get the vaccines, get your booster shots. Make sure that you are protected. You do not want to be counted and increase the amount from 57,000 to 58. Please reflect on that and remember that viruses are totally and completely unpredictable. So we have an independent, trusted set of science that we must remember, we must think about, and we must follow. And make sure that Canadians are informed. Make sure that we are not, if we're not worried and think that we're invulnerable and will never get COVID and can walk around ignoring it, remember we have a duty to the people around us who could get sick, who could in fact be impacted by this. So let us not forget that this is a duty to others as well in a pandemic. There's the other thing to remember in this remembering about recovering from COVID is that COVID-19 was a pandemic. It was the first pandemic we really ever had, true pandemic, since the influenza after the war. So what we need to remember about this is that it's no longer going to be epidemics. We're going to have pandemics. Because of globalization, people who never traveled before are traveling all around the world, bringing back viruses, bringing back diseases, bringing back illnesses, and we're talking about people from every corner of the globe. So the transmission of any illness, any disease, is quicker and easier in this world of globalization. So we need to remember that. Many countries as well, if a pandemic begins and we feel that we have not taken steps to prevent it from happening, many countries suffered and had 6 times the amount of deaths that Canada had because they didn't have the resources. So many countries suffered a great deal. Is that what we want for other countries in the world? So this duty of care is ours to remember. Now, our third duty is to be prepared for any other pandemic, to be prepared for the recurrence of COVID-19, to make sure that we learn something from the COVID-19 pandemic, learn things, let us apply what we learned. Let us not repeat. Those who do not learn from history are doomed to repeat it. So let's not have a repetition of another COVID-19 in this country or everywhere. We remember all the people who lived in homes and institutions, the elderly people who died, who didn't have to, and died alone because they did not have family with them to look after them because of isolation, etc., that needed to happen. So I'm just asking you to remember for those reasons, learn our lessons, and to look at how we apply those lessons to preventing future pandemics, and to make sure that we always mark this day to remember the three things that I asked you to remember. Now, this bill is a Senate bill, was brought in by a family physician in the Senate, Dr. Hedy, and she, again, as a physician and as I am, have understood the need to apply science to things like pandemics. Science is clear. Science is evidence-based. Science learns from the things that we made mistakes on or from the things we learned how to do to deal with future occurrences. Let us be mindful of science. Let us not apply ideology to pandemics. Viruses don't particularly care whether you live in Ontario or whether you live in Newfoundland. The COVID-19 didn't really care. It did not understand provincial boundaries. It didn't respect provincial boundaries. It didn't care. And let us remember that when we talk about how we deal with scientific evidence to protect ourselves and others. And again, as parliamentarians, our own duty is to remember to be aware of science, and our duty of care to all the people that we represent in this House, of all of Canada, to remember that we have a duty to care for them. In the same way we care for them when they don't have good drinking water. In the same way we care for them when they're suffering from poverty, when they say that the food prices are too high. Those are the ways we care. Let us continue to care. And so when I hear of people who continue to debunk science and say science is nonsense, let us let politicians make decisions. I say politicians should make informed decisions based on good knowledge, good information, and to therefore look at how that information tells them what they should do, to look at whether they will get results from what they're doing because they're following good evidence-based decision-making. There isn't too much else I can say about this, but to remember that we need to know that we have Remembrance Day. Why do we have Remembrance Day on the 11th of November every year? Because we want to remember the wars. We want to remember the number of people who died. We want to remember the damage. We want to make sure it doesn't happen again. We want to commit ourselves to peace. We want to commit ourselves to preventing war. So similarly, we want to commit ourselves to preventing pandemics that kill people. And we need to be aware that the deaths of 57,000 Canadians could have been prevented if we knew and understood the pandemic when it first started. We now know. We now know what the pandemic did. We now know how to stop it. We now know what the steps we need to take to remedy it. Let us remember that on every year so that we don't repeat the same mistakes we made, so that we learned our lessons. We're using evidence-based scientific methods to help to protect Canadians and the Canadian population. I don't have much more to say about this. It's a pretty simple bill. I hope you will all support it. Thank you.
Questions and comments. Questions et commentaires, l'honorable député.
The honourable member from Repentigny. Thank you, Madam Speaker. And I'd like to commend my colleague for having tabled this bill. In her speech, she spoke of the likely causes of the pandemic and that there likely would be future pandemics because people are traveling a lot between different countries and can bring viruses with them. I have another theory, and this would more so be about the loss of biodiversity and the inaudible. We have one of our members not hearing interpretation. Is it working now? Is it working?
Yes, I'm not getting it at all.
Well, that's it, so it's not working. Let's try
it again and see what happens.
Can you hear it now? You're hearing it? Okay. Apologies. Honourable member, you can start again. So I will start again by thanking my colleague. And in her speech, she spoke of the potential of the spreading of viruses because of people traveling a lot and that this could cause new pandemics. But I think we also need to look at the loss of biodiversity, how close human beings are to animal species that we aren't normally in contact with. So what does she think about this idea that we may have an increase in pandemics because of a decrease of biodiversity? Honourable Member for Vancouver Centre.
I think that's a very important point, and I think we know that zoonists are on the rise. And once again, it's because people are in contact with the animal world more than we used to be able to be in contact with them. We're visiting game farms, we're doing all kinds of ability to meet with wild animals in the wild. But we forgot, and this is what we learned and must remember in this pandemic Remembrance Day, that zoonists are very important, that transmission of viruses and bacteria and other diseases from animals to human beings are actually very, very possible. And so I'm glad you asked that question, because I think that's a reason for Pandemic Observance Day, is to remember that we've learned some things, and that's one of them. Thank you.
Questions and comments? The Honourable Member for Vancouver Kingsway.
Thank you. I'd like to thank my honourable colleague for this bill. And if we're remembering the pandemic, one, I think, particularly critical fact to remember is that Canada had the terrible distinction of having more deaths per capita than any other country on earth in long-term care homes. And part of the Confidence and Supply Agreement between the New Democrats and Liberals is for this government to introduce a Long-Term Care Act. And I'm wondering if my honourable colleague agrees with the New Democrats that it's time that we had mandatory standards in long-term care homes in this country, so that we have minimum standards of hours of care for people in those homes, where we have set care aid to patient ratios, and more importantly, we make sure that the conditions of work are the conditions of care, and we treat the workers in those homes much better so that we can reduce infection rates. Does she agree with the NDP that it's time to put those mandatory standards in law in this country?
The Honourable Member for Vancouver Centre.
Once again, I think that's a good question, and I want to thank the member for bringing it up. But I think we need to remember one very important thing. While it's very important to look at standards of care, while it's very important for us to make sure that, in fact, that huge death toll in long-term care homes that we saw, it is not a federal jurisdiction to do those things. Long-term care is provincial jurisdiction. So we are, at the moment, negotiating with provinces to look at how we get that done, so we don't trample on the provincial jurisdictions. At the same time, what we can do is get standards worked on and researched through the Canadian Standards Association to look at what it could look like as soon as provinces decide to set those standards and to set the kind of decision-making and bells in the provinces to be able to deal with long-term care. Thank you.
Questions and comments, the Honourable Member for Nepean.
Thank you, Madam Speaker. This is a very important bill, because this is also a wake-up call for policymakers every single year. Next time the pandemic hits, we can't say it was unexpected. So it's a wake-up call for us once in a year to check whether we have taken enough measures to secure Canadians from identifying the critical items that get affected when the supply chains are disrupted, to find out what are the things we have done for the senior citizens. And on the second thing, the Remembrance Day, Pandemic Remembrance Day is also important for new generation, next generation of Canadians. The current students in the elementary schools and the future students in the elementary schools, they should be made aware what their elder siblings, their parents, their grandparents went through, and so that they're aware that one day they too may get affected under this. I would like to have honourable members comment on that.
The Honourable Member for Vancouver Centre, very brief comment.
Some very good questions here. I want to be able to point out that we're talking about COVID pandemic, but let's remember that measles, mumps, rubella, diphtheria had all gone, had all died. Smallpox, they were not occurring anymore. They're coming back now because of vaccine deniers, people who are not vaccinating themselves, and we're going to see polio once again, with children who are sitting in iron lungs because they got polio. We cannot remember that we cannot deal with with any disease unless we are bound by scientific knowledge that we do. And right now, many people are walking away from the scientific knowledge that we got from learning on vaccines, and they're not vaccinated.
And we are unfortunately out of time.